Recorded?
Yes, it is.
Perfect. Thank you, Daisy. So today's meeting agenda for the Electronic Health Information Advisory Group was posted on February 28th, 2024 on dhcfp.nv.gov and at notice.nv.gov. So first, we are going to start with roll call. So I'm going to start with the voting members first. And so just please let me know if you're here. Okay, so first we'll go with Dr. Chris Lake. Oh, I saw you talking, but.
I'm here. Can you hear me?
Perfect. I can hear you now.
Okay.
Yes, thank you. Brooke Greenlee. Okay, Ashley Jonke. Dr. Quinn Polly.
Here.
Thank you. Andrew Topper.
Here.
Thank you. Michael Gagnon.
I'm here. Thank you.
Thank you. Chuck Podesta.
Here.
Thank you. Dr. Vilas Sastry. Michael Kennedy.
It's here.
Thank you. Eileen Colin.
Here.
Thank you. Dr. Eddie Ableser.
I'm on.
Great, thank you. Sarah Bradley.
I'm here.
Thank you. Kathy Denauer.
Here.
Thank you. Dr. Mark Rosenberg.
Here.
Thank you. Dr. Darla Zarli.
Here.
Thank you. And Lynn McAllister.
Here.
Great, thank you. And I just want to confirm, Daisy, do we have quorum?
Yes, we do.
Great, thank you. And then I want to move on to the ex officio members. If you could just note if you're here or not, please. So we'll start with Sandy Rubelit.
I'm here. Good morning.
Great, thank you. Shelley Aguilar.
Good morning, I'm here.
Good morning, thank you. And myself, Melinda Southard, I am here. Kevin Dick.
Yes, I'm here.
Great, thank you. Dr. Furman Ligon. Okay, Cody Finney.
Here.
Great, thank you. Scott Kipper.
Here. Good morning.
Good morning, thank you. Russell Cook. And Celestina Glover.
I'm here, it's Celestina.
I'm so sorry, thank you.
Okay.
Perfect. All right, so now that we have quorum, we'll go on to move to agenda item 3 with public comment. And I did want to note for everybody, I just see that Dr. Vilas Sastry has joined us, so I will mark him as present. Thank you so much. All right, so for public comment, because of time considerations, the period for public comment by each speaker or organization may be limited to 3 minutes, and speakers are urged to avoid repetition of comments made by previous speakers. If you would like to provide public comment, please raise your hand utilizing the Teams platform, or if you are calling in, please press *5 to raise your hand and then *6 to unmute yourself when called upon, or you can type in public comment in the chat and the last 4 digits of your phone number and your name so that we can call on you to begin. We ask that you please first state your first and last name at the beginning for recording purposes. And I wanted to see if there was any public comment. All right, seeing none, we will go ahead and move on to agenda item number 4. Welcome and introduction of the advisory group members. So to welcome all members to the group, I'd like to ask that all appointed voting members please be prepared to introduce yourself with your name, agency, and the reason you applied to be part of this advisory group. And I will go through our list and just call each voting member, and please feel free to introduce yourself. So we'll go ahead and start with Dr. Chris Lake.
Great. Thank you, Melinda. I'm Christopher Lake. I am the Executive Director of Nevada Hospital Association. And I applied to this group because we feel that there'll be a wide impact to hospitals and to medical providers, and wanted to make sure that we were heard in any regulations that were being considered. Thank you.
Great, thank you. And next, I did want to note that I did see Ashley Jonke is on. So Ashley, if you could please introduce yourself for the group.
Hi, everyone. Sorry I'm not on camera. Melinda, great to see all of you. I do not have my computer, so I'm on my iPhone, so I apologize. But Ashley Jonke with Anthem Blue Cross Blue Shield. I'm very happy to be here and very happy to see all of you. So thank you very much.
Great, thank you. Moving on to Dr. Quinn Pauly.
Hello, I'm Dr. Quinn Pauly, family doc, longtime Nevada resident, private practice, primary care, and I also volunteer on the board of the Health Information Exchange Nevada, and just hoping that I can have some input as to the clinical utility of the electronic health record.
Great, thank you. Moving on to Andrew Topper.
Hi, Andrew Topper, Director of Architecture at Optum, and I applied so that I could help improve the health of Nevadans.
Great, thank you, Andrew. Michael Gagnon.
Yeah, thank you, Melinda, and thank you, Director Whitley, for selecting me to participate in this. My name is Michael Gagnon, and I'm Executive Director of Healthy Nevada, the nonprofit organization that runs the only currently certified HIE in Nevada. And I applied because I have like 30 years experience in health information technology, 20 of which has been specifically in health information exchange. I've helped form up or operate HIEs in Vermont, New York, Michigan, and Wisconsin, and I've been leading Healthy Nevada for the last 6.5 years. And while I believe my organization can play a role in this interoperability for Nevada, I will leave those decisions to this committee and to the regulations that come out. So I see my role as really bringing my experience and knowledge about HIE to help this group, develop the regulation that provides the effective data exchange framework for all hospitals, providers, payers, organizations, and ultimately for the citizens and visitors to Nevada that saves money and saves lives.
Great, thank you, Michael. Chuck Podesta.
Thank you, Melinda. Yes, I'm Chuck Podesta. I'm the Chief Information Officer for Renown Health. Actually been a CIO for almost 30 years now in the healthcare IT world. Happy to represent the hospital industry, on this committee. I'm also on the Healthy Nevada HIE board as well. So thank you.
Great, thank you. Dr. Vilas Sastry. Sorry, I hope I got that right.
Hi, everybody. Nice to meet you. I'm the CEO of Teledentry.com. And when we were looking at this invitation, we wanted to have the opportunity to present dental points of view when it comes to electronic health information sort of stuff. And so that's the reason why we decided to apply, and really honored to be a part of this group, and I look forward to the conversation.
Great, thank you. Michael Kennedy.
Hi, my name is Michael Kennedy. I'm the Information Security Officer with the Division of Public and Behavioral Health, and I applied, I guess, to help make sure we're always considering security with any of the work we do.
Great, thank you. And Eileen Colin.
Hello, Eileen Colin. I'm with Comagine Health. I'm the state director for Nevada. And I'm really interested in supporting the adoption and expansion of electronic health information throughout the state, really to support improving public health by improving outcomes, reducing costs, and completing, connecting the health information.
Thank you so much. Dr. Eddie Abelizer.
Good morning, everyone. My name is Eddie. I run Tri Strategies. It's a public affairs firm here in Nevada and most Western states. I've had the privilege of serving historically as administrator at ADSD as well as deputy administrator in DPBH. Had the fun challenge of onboarding Harmony over at ADSD, and the topic of healthcare information records certainly is something that resonates throughout this state. I'm on representing Freedom Care, one of my clients, which does a lot of work in the personal care sector. And as well, Dr. Sastry, I represent the Nevada Dental Association and did a lot of work on the teledentistry legislation this past session. So looking forward to collaborating with all of you and seeing how we can help make this a better, more consumer and provider friendly platform across the networks. Thank you.
Wonderful, thank you. Sarah Bradley.
Hi, I am the Deputy Executive Director of the Nevada State Board of Medical Examiners, and so I'm here hopefully to help with what we know and what we can help with. Obviously, what happens with electronic health information is going to affect a lot of our licensees, so we're interested and just want to be a part of the conversation.
Great, thank you. Kathy Denauer.
Good morning. I'm Kathy Denauer. I'm the Executive Director for the Board of Nursing in Nevada, and we regulate just over 70,000 nurses in our state. So as a healthcare provider for over 40 years, I have an interest in its two facets. One, as a regulator, and how nurses are very involved in electronic records, but also as a consumer of healthcare. So that is my interest. Thank you.
Great, thank you. Dr. Mark Rosenberg.
Hi, my name is Mark Rosenberg. I'm a pharmacist licensed in the state of Nevada, currently working as a pharmacy manager at Vaughn's Pharmacy, and I have a special interest in healthcare informatics, and thank you so much.
Great, thank you. Dr. Darla Zarli.
Hello, good morning, everyone. I'm Darla Zarli, and I'm with the Prescription Monitoring Program with the Board of Pharmacy. And obviously, I have an interest for this group because it does impact some of our end users. And I do have a lot of experience with data sharing, but not necessarily in HIE, but data sharing with Prescription Monitoring Program across state lines.
Great, thank you. And Lynn McAllister.
Hi, everyone. Lynn McAllister. I'm the Director of Quality Infection Prevention and Informatics at Centennial Hills Hospital. I'm looking forward to collaborating with this diverse group to set up the structure and improve the collaboration and sharing of our patient information, supporting both our members of our state and also our visitors.
Wonderful, thank you so much. And now we'll move on to the ex officio non-voting members. So I'll go ahead and get this group started. So for those of you who do not know me, my name is Melinda Southard, and I'm a Deputy Administrator at the Division of Healthcare Financing and Policy, which is also known as Nevada Medicaid, over community supports and engagement. So I'm excited to note that I will be celebrating my first year with the division later this month. And before this, you may have seen me as the Executive Director for the Patient Protection Commission. Prior to that, I had several years of experience with the Division of Public and Behavioral Health and Public Health Emergency Preparedness. And as a fun fact, I am also a retired chiropractor. So next we'll move on to our ex officio members. So I'll start with Deputy Sandy Rubelit.
Good morning. I'm Sandy Rubelit. I'm a Deputy Administrator with the Division of Healthcare Financing and Policy. I've been with the division over 20 years. I oversee our IT section and HR. And I've had involvement in our HIE efforts for quite some time, and I'm happy to serve on this committee. Thank you.
Thank you. And we'll move on to Shelley Aguilar.
Hi, good morning, everybody. I am Shelley Aguilar. I am Chief over Program Operations, Support, and Targeted Outreach with the Division of Welfare and Supportive Services. Next month, I will be hitting my 15th year with the division, so I'm looking forward to that. And the areas I oversee are quality assurance, our business processes, our SNAP outreach program, and our targeted outreach program. So thank you so much. I'm excited to be here.
Wonderful, thank you. Kevin Dick?
Yes, good morning, everybody. I'm Kevin Dick. I'm the District Health Officer for Northern Nevada Public Health. And I'm actually retiring in the next few months. And I'm going to have our Division Director for Community and Clinical Health Services participating on this advisory group. And that's Lisa Lotritz. She happens to be away from the office this week, so I'm covering this intro meeting. But from the public health perspective, of course, we're interested in the efficiencies of electronic health records in healthcare, as well as actionable data that might be accessible as we work on data modernization, looking at emerging diseases, trends in diseases, et cetera. Thank you.
Wonderful, thank you, and congratulations on your upcoming retirement. Very exciting. And next, we'll move on to Administrator Cody Finney.
Good morning. My name is Cody Finney, and I am the administrator of the Division of Public and Behavioral Health for the Department of Health and Human Services in Nevada. I've been with the department a little over 25 years now, and I am just happy to be here serving and making sure that Kevin said it best, that we're able to maximize the efficiency of the use of health data to improve the health of Nevadans.
Fantastic, thank you. And lastly, we'll go on to Commissioner Scott Kipper.
Good morning, everybody. I'm Scott Kipper. I'm the Insurance Commissioner for the state of Nevada. We're housed in the Department of Business and Industry, and here to really looking forward to providing whatever expertise that we can from the division's perspective as far as where insurance regulation meets electronic health information. So I'm very pleased to be here.
Wonderful. Thank you so much. Appreciate you all being here today and participating on this group and the important work ahead. So next we'll move on to agenda item number 5. We'll have an informational presentation on open meeting law presented by Gabe Lyther. And I think that Daisy, you had the copy of the slides that we can share for Mr. Lyther. Perfect.
Thank you. So this is Gabriel Lyther. I will go ahead and start now. Before I get into things too much, can you guys hear me if I speak like this? Someone nod or yes. Shake your head no. Okay. Fantastic. Let me know if at any point you can't. I know at some point in the past I had a computer that nobody could ever hear me. So I spent a few $100s and got a little better MacBook. Hopefully you guys can hear me now. So I am Gabriel Lyther. I've been with the Attorney General's office for a little over 20 years, and I've been representing Nevada Medicaid for almost the entire time. I will probably be attending most of these meetings and will be counsel to this advisory group and helping Melinda out with any questions that she has. And if I can't answer the questions, I will go to some resources who can help answer those questions. So one of the resources I actually have identified on this first slide here, which is Rosalie Bordelove. She's with our office, and she's actually the individual who is the chief at our office who is over open meeting law. I left her name on this presentation because she is the individual who actually prepared this. I went ahead and removed a little bit of information from the presentation that she had in the interest of time, and she got into the weeds a little bit more than what I think we need to, but I thought that she should get credit for actually preparing this PowerPoint, so I left her name on it. So let me go ahead and start with, have us move to the next slide. There are 5 things that she wanted us to touch on. And I'd like to just begin all of this with an overview that this will be very cursory, very, very overview. I would say that from the names that I see on this this group, I think many of you, if not all of you, have already participated in groups where the open meeting law applies. which is nice. In fact, I think a couple of you could probably teach this as well or better than I could. But it's always nice to have a little overview. And with that in mind, we have this presentation and 5 issues which we will look at. What is the open meeting law? When does it apply? How do we comply with it, which is both for you as members and also a helpful reminder for us as the agency helping to run it. What happens when it's violated? And then when do we need to disclose or abstain from voting? So if we could then turn to the next page. What is the open meeting law? It is set forth in NRS chapter 241. It has all of the details regarding the open meeting law. But I like to think of it as primarily one of the drivers to ensure that we do things in Nevada in the most transparent way possible. There is a very big concern throughout the nation, and especially in Nevada historically, that certain items would be done in secret behind closed doors. You may have heard sometimes Nevada is referred to as a sunshine state, where we really try to make sure that everything is done as transparently as possible. So we have the quote that in enacting this chapter, the legislature finds and declares that all public bodies exist to aid in the conduct of the people's business. It is the intent of the law that their actions be taken openly and that their deliberations be conducted openly. The open meeting law requires that public bodies take all of their actions and deliberate openly. And this is the stated intent. It's to be transparent in everything that we do, no backroom deals. When I think of like some of the lack of transparency, it's funny when I think about open meeting law, I think sometimes about school board meetings primarily. You know, it's really something that comes up a lot is how many times people get upset about actions that people take, especially on school boards and on some other agencies. And their concern is that some of these actions may be taken behind closed doors and it's all kind of a sham and not done publicly, transparently. Luckily for the meetings that I've attended with Nevada Medicaid, we don't generally have as contentious as those issues that are involved with school boards. I expect that this particular issue regarding the AB 7 and the implementation of this framework will perhaps get a little more public comment than some of the stuff that we usually do. But frankly, with Nevada Medicaid, in the 20 years I've represented Nevada Medicaid, there's been 2 or 3 public meetings that have been really kind of somewhat contentious. For the most part, they're very smooth, so that's nice. Let's go ahead and turn to the next page. When does the open meeting law apply? Important here is that it applies whenever there's a public body, and the open meeting law applies to all meetings of public bodies. There's a definition of that in NRS chapter 241, but generally public bodies are bodies created by statute, executive order, or by action of another public body. This includes subcommittees, and we can flat out know that for this group, it is subject to the open meeting law and is considered a public body. If you ever have any questions in some other body that you're in, ask your counsel. Under the open meeting law, a meeting requires a quorum plus deliberation or action. And quorum means a majority of the total body or other proportion established by law. Generally, it's just a simple majority. There is a group I have that I'm involved with Nevada Medicaid, the Silver State Scripps Board, where actually they have by law something else differently although they have the same law regarding a quorum. In order for them to take any action, they have to have a vote of a majority of all the members, whether they are in person or not, which is the same rule that exists for elected bodies. But that does not apply here. So for here, we will look to see how many members actually show up, and then we will require a majority of those who are there to take the action. It is very important you guys try to attend the meetings, because I can't tell you how many meetings we've had to cancel because we haven't been able to have a quorum, which is always frustrating, especially when you come up on a deadline. Let's go ahead and turn to the next page. When does the open meeting law apply? It applies whenever there's a gathering of a majority of the members who are present. So obviously applies at meetings like this one today, but it can also apply whenever there's a gathering at a social function, for example. If the people start deliberating or discussing items related to the business of the board. Electronic communications can also constitute a meeting. And so one of the pitfalls that's noted on the slide is that when people reply all, or if you start to communicate amongst yourselves outside of this meeting or outside of the meetings that are scheduled, that can absolutely constitute a meeting. And it can also constitute a meeting, even if you do it with only a few, but then those few start contacting others, and you have what is called a serial communication or a walking quorum, which can exist when you have less than a quorum speaking together if the opinions are then relayed down the line. So you may have just 5 members on a committee, but if 2 of them start discussing something and then one of those starts discussing something with others, then next thing you know, you have a quorum. So, or you have a meeting. So it's important to not discuss things outside of the meeting. And it's as far as email, it's helpful to BCC, which I've noticed that we've already done to you guys, which is helpful. So you can't reply to everyone. And if you do have communications that you need to make them to only the chair or to Melinda and not to other members outside of this, outside of the scheduled meetings. Let's go ahead and turn to the next page. How do we comply with the open meeting law? Let's turn to the next one. So the meeting notice must include the time, place, and the location or information on remote technology. The remote technology is just amazing to me how far this has come within my career. I mean, just, we just conduct so many things now. And I think obviously, COVID helped facilitate this, right? Make this even that much faster. So now we do so many things over remote technology, but we must have the time, place, and location, must have the name, contact, and business address for the supporting materials, a clear and complete statement of the topics, and action items have to be denoted as for possible action. If they are not denoted as being for possible action, you cannot vote or take action on them. And then obviously you must have public comment as well. So a couple of additional things regarding this slide. A higher degree of specificity is required for agenda items of substantial public interest. So I think that arguably some of this does have substantial public interest. We will try to be a little bit more specific on some of our agendas to make sure people know specifically what we are contemplating taking action on. But generally, Nevada Medicaid already does a really great job of having specificity in their agendas. I've seen some agendas from a few other divisions that perhaps don't have quite the specificity that Nevada Medicaid does. I think that when you look at the clear and complete statement standard, that I think it's quite clear that Nevada Medicaid meets that, and people know generally what we are contemplating doing when they look at the agenda. There's information on the slide regarding the posting of the agendas, and then we must send to any person who has requested notice of the meetings a copy of those agendas as well, so that they have that if they request it. Let's turn to the next page. Couple of highlights from this slide is that public bodies will make reasonable efforts to assist and accommodate people with physical disabilities desiring to attend. That's especially important, I think, in something like, frankly, all of the business that Nevada Medicaid does, because we have many members of the community who have disabilities who are interested in all of the actions that we take. We have additional notice requirements for considerations of people's character, but we don't really need to spend time going on that since that's not something that this body will be really working on. Meetings must be recorded or transcribed, and minutes must be kept. One comment that has come up, or one question that comes up frequently, is if you're not present, can you still vote on the adoption of the minutes? The answer is absolutely yes, you are allowed to, and you don't need to preface your vote with, well, I wasn't there last meeting, but I'm going to vote anyway. You can just vote. You don't need to say that. Supporting material is required to be available to the public at the time is provided to members of the public body. That's especially important as we move to so many meetings where we have them on communication means like this, remote technology. So it's important to have those available to the members of the public quickly. Also, anything that we can see or that you guys can see, the members of the public should be able to see as well. One final thought is that as we talk about accommodations for members of the public, it's important to try to schedule a room when a room is scheduled in a manner that will facilitate the people that we are expected to attend. We've almost always done that. Once or twice, I remember we were surprised with how many people attended, and that's always horrible when you have a room scheduled that can hold, 20 or 30 people and 200 people all of a sudden show up. All right, next slide. Public comment. All right, so this is great. A couple of minimum requirements are 2 options, general or limited to agenda items prior to any action item, or on each action item after discussion but prior to vote, and general public comment period at some time prior to adjournment. Those are minimum requirements. We are allowed to go above and beyond that, which Nevada Medicaid has frequently done in the past. HHS has frequently done in the past. Restrictions can be made to make reasonable time, place, and manner. So, for example, limiting the amount of time that each speaker can spend, but you cannot forbid speech just because we don't like what it is. Obviously, if someone is being very obscene or something of that nature, you can have restrictions to perhaps prevent that, but you can't stop it just because we don't like what they're talking about. So one of the things about public comment, I think of that as kind of like, back to the Seinfeld episode. I'm dating myself here slightly if you're too young and don't remember Seinfeld, but like what was it called? The airing of grievances, right? Was it Festivus? I think it was Festivus. Airing of grievances during Festivus. Festivus for the rest of us. I think that's what it was called. So the airing of grievances, that is part of what public comment is for. People want to be heard and express their frustrations with the system. But another thing with public is that, frankly, the public has a lot of really good ideas, especially as it relates to this field. So public comment is critically important and something that we really desire to have as much as we can and listen to those comments and use them. If we are using remote technology system, which we obviously are, we must offer at least telephonic public comment, which we do. Okay, next slide. Virtual attendance. Members of the public bodies may attend virtually, whether or not there is a physical location for the public to attend. If there is no physical location for the public, virtual attendance options must be provided. And one pitfall that's been noted there is the chat function in remote technology systems. I think generally we try to turn it off during these meetings because we certainly don't want members of committees chatting with each other, especially if members of the public can't see what's going on during those chats. There was some discussion recently about a school board again, where they've asked people not to be texting because it appears that they are texting each other about members of the business of the meetings during the school board meeting, which is not proper. Next slide. What happens when the open meeting law is violated? Everyone goes to jail. Do not pass go. No $200. Actions that have been taken in violation of the open meeting law are void, and the Attorney General's office has authority to investigate and prosecute. We can take corrective action, which helps, and it may mitigate the severity of the consequences, but it requires independent deliberative process. I will say that, there is even the potential for the Attorney General's office to prosecute in rare cases when there's been flat out violations of the open meeting law. I know that it's extremely unlikely that anything like that would happen here. Generally, what happens when I've seen something that like the open meeting law is violated is that there are attempts to cure it as quickly as possible. But the important thing here is that any action that's taken is in violation of the open meeting law. That action's void, and there's going to have to be actions taken to try to fix that. Coming to the home stretch here, next slide. So when do we need to disclose or abstain? And if we can go to the last page, well, second to last page. Disclosure is mandatory for any interest created by a gift or loan, substantial pecuniary interest, a commitment in a private capacity, etc. And it must be made at the time the matter is considered and prior to discussion. It must be sufficient to inform the public of the nature and scope, but abstention is required only in clear cases where the independence of judgment of a reasonable person in the public officer's situation would be materially affected. If you have a question regarding whether you should disclose or abstain, and I will note that in something like a body like this, that sometimes people have obviously connections to certain private, or other governmental, just groups in general that may benefit somehow from some action that we're taking one way or the other, or it could be impacted to some degree by some action that this group takes. But that is to some degree one of the reasons why some of you are actually specifically on here, because of the expertise that you have in those fields. And I would stress that, again, this is an advisory group. So what I would recommend is that if you think that you have any issues that require disclosure or abstention, certainly disclose them. And if you think that there's a possibility that they will rise to something that perhaps might require an abstention on some point, flag that to Melinda, flag that to me, and we will discuss that with Rosalie. But I don't think that will be something that will prevent anyone from voting, at least in part because this is an advisory group, and frankly, what we want all of you to vote and to help make these recommendations. All right, next slide is just the slide that asks if anybody has any questions or comments or concerns. There are a few links there. The links on the left include a couple of sites there. And actually, if you look at the ag.nv.gov site, there's actually the open meeting law manual as well. So if any of you are out of, I don't know, need help sleeping, you can read the open meeting law manual. It's actually very well written, but it will still probably help induce sleep for some of you. Any questions or comments? No? Okay, you've been a captive audience. Thank you, guys. Melinda, back to you. No fun facts from me.
No fun facts. Thank you, Gabe. All right, so now we move on to the next item on the agenda. We have administrative rulemaking process by Parent Tax. So I'm going to turn it over to Ms. Parent.
Hi, everyone. So let me just get my screen shared real quick with my presentation. Can you guys see that?
Yes. Thank you.
Okay. Great. So I am Karen Takis. I'm a senior deputy attorney general that is on the same team as Gabe. I primarily represent the Division of Public and Behavioral Health, but I am going to be giving a brief presentation on administrative rulemaking for this public body. Similar to Gabe, I'm going to give a higher level presentation, but I will also connect you with more resources if you have additional questions or want to learn about rulemaking further. So first, I just want to plug, we do have all of our trainings posted on our Attorney General website. Included there is a training that I've presented on administrative rulemaking that is lengthier than the one I'm going to give today. It's about an hour long. The slides are also posted there. So if you guys are ever curious or have questions and want to look into those trainings further, that's where you can find them. So a roadmap of today, I'm going to go over administrative rulemaking under NRS Chapter 233B. We're going to cover authority. So where does the authority come from to engage in rulemaking, and who is authorized to engage in rulemaking? We're going to go over what is a regulation, when does NRS 233B apply, and when is it exempted? And then how do I do it? There's three types of regulations. There's permanent, temporary, and emergency. Before I dive in, I also wanted to highlight a few of my favorite resources that are available online. So the Attorney General's Office also publishes a rulemaking manual. So this is a paper format. If you have a question and don't really have time to sit through a training, this is a really good guide on the step-by-step process of going through rulemaking. I also like to point people to the Nevada Register of Administrative Regulations. This contains every draft of every regulation that's been put forward. So it includes initial drafts that are approved by the public body, and then drafts that are approved and enacted. So this is a good example to look if you're trying to figure out what should an initial draft look like, or what does it look like once LCB has returned it with their edits. And then the next two resources I think are for real nerds, but the Legislative Council has a preface to the NRS, and it explains how the NRS sections are formatted, and our administrative code follows that same format and explains what those sections and subsections look like. And then I also like to point out a recent Nevada Supreme Court decision, Killebrew v. State of Nevada, as an example of where an agency did rulemaking right. So it goes step by step through a state agency that put regulations forward and were challenged in court. And the Nevada Supreme Court upheld those regulations and said, no, agency, you did a good job. You went through all the steps that are required to put a regulation forward. So jumping in, authority. This is your ticket to ride. This is the ticket to engage in rulemaking. So an agency or a public body must be specifically authorized to pass regulations. And that authorization will be in the NRS. There will be an enabling statute, which will say you agency or you public body have the authority to pass regulations on XYZ. So as it relates to this public body, what is the authorizing statute? This is a recent bill. I'm sure you guys are aware this is the first meeting, but Assembly Bill 7, 2023, and in conjunction with NRS 439.589, sets out that this public body's authority is to advise on regulations. And so to go a little bit further, the bill outlines that the director of HHS is the one with the authority to pass those regulations. And so it's this public body's responsibility to advise on what those regulations will be about. So to further clarify, this public body is not the one that is going to be engaging in the step-by-step of what I'm going to give an overview on today, but it's still really valuable for you guys to know what that process is, because it'll inform your guys' decisions on what regulations need to be adopted and what that process looks like going forward if the director chooses to take those up. So in your case, it's a ticket to advise rather than a ticket to ride. And then also Assembly Bill 7 outlines the specific charges for this public body. So you're not making recommendations on regulations just generally, you have that specific scope. So what is a regulation? Taking a step back, I'm going to start with the basics. Our legislature passes laws, and those are put into statute. So our NRS, our Nevada Revised Statutes, those are passed by the legislature. And then regulations are created by agencies, boards, and commissions. And the purpose of regulations is to explain how laws should be carried out. And the reason that that is delegated to agencies, boards, and commissions is you guys are considered the subject matter experts. So the legislature, our legislators do have subject matter expertise in certain areas, but generally the legislature as a whole is not experts on everything. So that expertise is delegated out for setting out what should be in regulation. So our regulations are codified in the Nevada Administrative Code, or the NAC, and they carry with them the force of law. So they are as much a law as a statute is, in that the public must abide by them. Now, NRS 233B is the statutory chapter which sets out the process to create regulations. So we define, there is where we find what a regulation is defined as. We have this nice statutory definition. that can feel a little bit heavy, and it's like, okay, we get it, NRS, but what is it really? So the section of this that I really like to point people to is an agency rule, standard, or directive or statement of general applicability, which effectuates or interprets law or policy or describes the organization, procedure, or practice. The key term there is general applicability. So this is applying to the public in general or to all licensees. So just something that is going to apply to the objective group similarly. It's not something where there's going to be different rules case by case. It will contain a mandatory requirement or standard that the agency will use. And this can affect private rights or procedures that are available to the public. So if it's something more specific, then that's exempt. That's not considered a regulation. Also, the NRS sets forth certain things that are not considered regulations. So contract terms are not considered regulations. Okay, so permanent versus temporary. Again, I'm going to give a high level view of these. There's 3 types of regs. There's permanent, temporary, and emergency. When you're considering whether or not permanent or temporary are going to be adopted, your first question is, what day is it? Nevada goes off of a season for permanent and temporary regs that's based on when the legislature is meeting. The Legislative Counsel Bureau is the body that assists with drafting regulations. And so because they are also assisting with the legislature, they can only assist with regulations on that off season. So if you're doing permanent regs, you're going to submit those between July 2nd of an odd numbered year and June 30th of the following even numbered year. If you are doing temporary regs, that's going to occur between August 1 of an even numbered year to July 1 of the following odd numbered year. And these flowcharts show the process for each of those. For temporary regs, you'll notice that it's a shorter process to put those forward, but the catch is that they're only valid through November of the odd numbered year. So if you as a public body or an agency want the regulations to carry forward in time, you'll have to go through the permanent reg process. And so you can see here that there's a number of steps. There's the workshop, and the goal of the workshop is to get public input from stakeholders as to what they think on those regulations. And then there's LCB review. That's when you submit a draft to the LCB. And then you can take that draft forward to a public hearing where, again, the public has an opportunity to do public comment. And then if there is significant public comment on those, well, if there's any public comment on those, the agency is required to take that into consideration. That's not a requirement to change the regulations, but they have to meaningfully consider the public comment and, if appropriate, make changes to those drafts. The next approval will come from the Legislative Commission, and then they're filed with the Secretary of State and become effective. There is a bit of a choose your own adventure for permanent regulations, so you can submit to LCB before you have that workshop. There's just a requirement that you have a workshop before it goes to public hearing. So these 2 flowcharts are included in the manual. The manual also includes this more hearty checklist of everything that you need to do. It includes the time requirements for when you need to post your notices. There's very specific time requirements for those. It includes what needs to be done for a small business impact statement. So if the regulation is going to affect small businesses, then you must consult with those small businesses on the economic impact on those businesses and draft a statement relating to the input that you've received. So again, the manual sets forth all those step-by-steps. I'm not going to get into the nitty-gritty of those today. Here's what the process is for temporary regs. Again, it's a little bit more flexible for temporary regs because the idea is that you're going to be going through the permanent at a point later in time. So small business impact statements, these are required for regulation. This is forcing the body that's putting regulations forward to consider the impact on small businesses. So a small business is defined. It's a business conducted for profit, which employs fewer than 150 small full-time or part-time employees. So 150, that's not terribly small. That can include quite a few businesses. Statute does not set forth how an agency is required to consult with those businesses. From my experience in advising Division of Public and Behavioral Health, there's a lot of listservs that we can use to reach those businesses. Oftentimes it's relating to licensees, so you can contact all those licensees through a listserv. You can post about them on your website or places that these small businesses often interact. Reaching out to business organizations or associations, professional associations is another really good way to seek that comment. So in your small business impact statement, you're required to identify how you went about consulting with these small businesses. So you prepare a statement related to those. That's included in your materials that you publish when you put regulations forward. Again, this is explained in more detail in the rulemaking manual. So the final step for permanent regulations is approval from the Legislative Commission. So who is the Legislative Commission? What do they review? They are a body of legislators. So it's half legislators from each house, and they give the final stamp of approval on regulations before they're enacted. They can object to regulations. Those grounds for objection are set forth specifically in the NRS. So there may be a case where they identify one of these issues with the regulations and send them back to the agency. And then the agency must revise those and return it back to LCB within 60 days. So emergency regs, this is the one last type of regulation I haven't touched on. These are pretty rare. An agency or public body with the authority to make regulations can do emergency regulations. So these are only valid for 120 days. There's no extensions. So if a public body wants those regulations to carry forward, they have to engage in the permanent or temporary and then permanent regulation process. This is a much shorter process. What's required is that the agency submit a statement of emergency to the governor. So this is a written statement saying this is the emergency that requires regulations to address that emergency. So I think a common misconception is there must be a state of emergency, a formal declaration state of emergency from the governor to engage in emergency rulemaking, but that's not the case. If there is an emergency that this agency has the scope over to enact regulations, they can submit a written statement to the governor. If the governor endorses that statement, then the regulations may be adopted. So again, it's a super shortened process, depending on what the body is to enact those regulations will kind of dictate how many hearings or public meetings there are to enact those. So, for example, if the Board of Health has authority to pass these regulations, they would need to first approve that statement of emergency that goes to the governor and then approve the regulations that go forward. So it could be at minimum just 2 actions on one meeting's agenda. So, and then this is just an update. There was a bill that was passed in 2023. It's AB 219, which amends NRS 241.023, which says that if a public body is holding a meeting to consider regulations, then there must be a physical location. And I would just highlight here for this public body, that's going to relate to once the rulemaking has actually started. So your role is to make recommendations to advise the department on what regulations are needed. So this would not apply in making that requirement of a physical location, but once those that intent to engage in rulemaking starts, that's when you're going to want to consider how this applies to you guys. So I have, a question slide here. If there's any questions, I'm happy to answer those now.
Oh, I do see we have a question. Michael Gagnon, please go ahead.
Yeah, it seems to me that the regulation coming out of this is probably going to be a temporary regulation due to the time frame. Is that accurate, Karen?
So I'll go ahead and
sorry,
answer.
I'm having.
I'll go ahead and answer that. So yeah, we are looking to do permanent regs. So we are on a very tight, swift timeline, and that, I want to get those submitted no later than June 30th of this year. So we may need to meet more than once a month, and we'll talk about that a little bit later in the meeting. But yes, we are intending to do permanent regs.
Okay, thank you.
Any other questions? All right. Well, thank you so much, Perrin. Really appreciate your presentation today.
Of course, thank you.
All right, so we will move on to agenda item 7, and just going to ask if Daisy could share her screen with the presentation on it, please. Thank you so much. All right, so we'll go ahead and move to the next slide, Daisy. So to help level set everyone, I'd like to give an overview of where we're going and what we hope to accomplish as a group and over what time frame. So we'll first outline the primary responsibility of this group, go over what the bill language reads in regard to that responsibility, and then look at some important dates ahead of us, as well as a timeline for how the next few months might look. Next slide. As noted in Assembly Bill 7 from the 2023 legislative session, the primary responsibility of this group is to advise the director of the department on the development and implementation of the regulations adopted pursuant to NRS 439.589 as amended by section 1.08 of this act. So for reference, NRS 439.589 describes the adoption of regulations to prescribe standards relating to electronic health records, health-related information, and health information exchanges. In the next several slides, we're going to review the bill language in section 1.08 because section 1.08 is amending NRS 439.589. So I'm going to show any added language to the NRS in blue italics. And for clarity, I did not include the strike-through language for what was removed from the NRS. So I'm going to apologize in advance because the next few slides do have quite a bit of reading on them, but I really want to take this opportunity to ground us all in the work that lies ahead and the intent of the regulations to be developed. Next slide. The bill has amended the statutory language to read starting in item 1 that the director of the Department of Health and Human Services, in consultation with healthcare providers, third parties, and other interested persons and entities, shall by regulation prescribe a framework for the electronic maintenance, transmittal, and exchange of electronic health records, prescriptions, health-related information, and electronic signatures and requirements for electronic equivalents of written entries or written approvals in accordance with federal law. The regulations must establish standards for networks and technologies to be used to maintain, transmit, and exchange health information, including without limitation, standards that require the use of networks and technologies that allow patients to access electronic health records directly from the healthcare provider of the patient and be able to forward that electronic health record electronically to other persons and entities. The interoperability of such networks and technologies in accordance with the applicable standards for the interoperability. And next slide, please. And then continuing that the regulations must establish standards, and all of this is original statutory language here. So these standards should ensure that electronic health records retained or shared are secure, to maintain the confidentiality of electronic health records and health-related information, to ensure the privacy of individually identifiable health information, for obtaining consent from a patient before retrieving the patient's health records from a health information exchange, for making any necessary corrections to information or records, and for notifying a patient if the confidentiality of information contained in the electronic health record of the patient is breached. Next slide. So now moving on with the amended language, in that the regulations must establish standards governing the ownership, management, and use of electronic health records, health-related information, and related data, and for the electronic transmission of prior authorizations for prescription medication. And then for those prescription medication prior authorizations, ensuring compliance with the requirement specifications and protocols for exchanging, securing, and disclosing electronic health records, health-related information, and related data pursuant to the HITECH and HIPAA and other applicable federal and state law, and be based on nationally recognized best practices, of course, for maintaining, transmitting, and exchanging health information electronically. I also noticed here that these items do start at B instead of A, but the bill language also shows this, so just wanted to be accurate there. Next slide, please. So item 2 of these amended provisions note that the standards prescribed by these regulations must include, per the original statutory language here again, requirements for the creation, maintenance, and transmittal of electronic health records, requirements for protecting confidentiality, including control over, access to, and the collection, organization, and maintenance of electronic health records, health-related information, and individually identifiable health information, requirements for how a patient can revoke his or her consent for a healthcare provider to retrieve the patient's health records from the health information exchange, a secure and traceable electronic audit system for identifying access points and trails to electronic health records and health information exchanges, and any other requirements necessary to comply with all applicable federal laws relating to electronic health records, health-related information, health information exchanges, and the security and confidentiality of such records and exchanges. Next slide. Continuing on with additional language added to these provisions, that the regulations adopted pursuant to this section must not require any person or entity to use a health information exchange. And subsection 4 here is important because this is the subsection that requires electronic maintenance, transmission, and exchange of health information in accordance with these amended provisions of NRS. Subsection 5 notes the exemption for the ERISA or Taft-Hartley Trust health coverage providers, and that they are not required to, but may maintain, transmit, and exchange electronic health information in accordance with the regulations adopted. Next slide, please. Subsection 6 notes a healthcare provider may apply to the department for a waiver from the provisions of subsection 4 on the basis that they do not have the infrastructure necessary to comply with those provisions, and goes on to note how the department shall determine to grant a waiver or not. And a quick note here, this bill did come with an appropriation of $3 million for the specific purpose of awarding grants to providers of healthcare and medical facilities so that they can comply with the requirements of subsection 4 and the electronic maintenance, transmission, and exchange of health information. The grants are to be prioritized to smaller providers of healthcare or medical facilities, so meaning those that have a staff of less than 50 people or who work for an entity that has a staff of less than 50 people. The Division of Healthcare Financing and Policy has been appropriated these funds and will broadly announce the notice of funding opportunity this July after the final draft regulations have been submitted to the Legislative Council Bureau. We are also hoping to utilize members of this advisory group in pushing out the announcement for the availability of these funds through all channels available. Continuing on, that subsection 7 notes an exemption for the Nevada Department of Corrections. Subsection 8 provides that a violation of the provisions or any regulations adopted pursuant is not a misdemeanor. And subsection 9 gives some final definitions. Next slide, please. So in knowing that was a lot to review in setting the foundational direction of this advisory group, a high-level summary is also provided here. So the first one notes the importance of really having so many of you at the table today, and is why we included healthcare providers, third parties, and a few key other interested parties such as state licensing boards, those involved in health information exchanges, health departments, and social service agencies. You are all important to this work, and I want to say again how much I appreciate we have having you on this committee. Another key feature of these regulations, and I know was the intent behind this bill, is the direct patient access and the ability for the patients to forward their health records electronically to other health providers or individuals that they would like to, with additional importance highlighted in ensuring particularly the interoperability of such health information systems, along with the security, confidentiality, and privacy of health information maintained and transmitted electronically. Next slide, please. The regulations this group approves in advisement to the director of the department must be sure to prescribe standards for making any necessary corrections to the information or records, notifying a patient if their healthcare record is breached, electronically transmitting prescription medication and prior authorizations, ensuring compliance with high-tech and HIPAA, and being based on nationally recognized best practices for electronically maintaining, transmitting, and exchanging health information electronically. In noting the waiver process for healthcare providers lacking the infrastructure to implement, I've already been asked about how this process will work. So again, just highlighting here that this is another process we must include in these regulations as we develop this draft, and that the regulations must include an exemption for ERISA plans and the Department of Corrections, meaning if they choose to comply with subsection 4, they may, but are not required to. Next slide. Now I'd like to move on to some important dates coming up, not too far out in the distant future. So per bill language, prior to June 30th of 2024, we must draft and submit regulations to the Legislative Counsel Bureau, or LCB, in order for those regulations to be considered permanent and receive Legislative Commission review and approval prior to the 2025 legislative session. I did note the drop dead date of June 28th to submit the draft regulations to LCB, but would like to aim to submit them at least the week before on June 21st, if that's possible. Wanted to also point out here, we will be submitting our draft regulations to LCB prior to the required workshop in regulations development that Perrin was talking about earlier. So the workshop, small business impact statement, public hearing, all that will all come after the June 30th deadline that we submit them to LCB. Next, the bill requires that before August 1st of 2024, we must present to the Joint Interim Standing Committee on Health and Human Services concerning the progress of developing and implementing these regulations. The June 10th meeting is the last one before August 1st. So I'm hoping to be able to present at that June meeting or potentially earlier. Lastly, this year, we are required to submit a report to LCB before December 31st for transmittal to the 83rd session of the legislature regarding the progress of developing and implementing the regulations. Next slide. Now to outline the roadmap of where I envision this group going. Again, it's going to be a fast trip. So March is our first meeting where we've hopefully met the goals of orienting the group and outlining group responsibilities. In April, we will plan to have our first rough draft of the regulations available for this advisory group to react to in providing critical feedback, input, asking questions, providing language edits, or resources with additional information, all of the helpful things to improve the language. And then in May, we'll do something similar with the second round of the drafted regulations, asking for reaction from the advisory group, and that the second draft will have incorporated all of the helpful comments and additions from the April meeting. Then in June, we'll be looking for a final review perhaps a final polish or tweaking of the language here or there, I hope, so we can arrive at the final approval of the draft regulations in advisement to the department director to submit to LCB by the June 28th deadline. I'll be sure to keep the members apprised of all the steps as they occur with regard to the draft regulations, meaning when they're submitted to LCB, any comment or feedback received from LCB on the draft, scheduling of the workshop, public hearing, basically all the steps in administrative rulemaking process. We would also welcome you to attend any of the associated public meetings that are held in regard to these regulations. We will be posting all associated meeting notices to the Electronic Health Information Advisory Group website, as well as distributing via our Medicaid updates listserv. I would also anticipate around the October timeframe, we would likely have some robust updates to share with you all and the public on the regulation adoption and perhaps the need to request guidance from this group on the implementation of the regulations. Additional meetings of this group beyond October will be scheduled as needed, with the caveat that additional meetings, if additional meetings are needed prior to the final approval of the draft regulations during that June meeting, that we may need to schedule more meetings than once a month. Just thinking about all the work ahead. And that is really all that I have for this agenda item. So wanted to open the floor for any questions on this overview information about all the work ahead. Chris, please go ahead.
I just had a really quick question, and that is, do you know of any other states that have similar regulations or laws in effect that perhaps we could study and look at?
Great question. I was actually just thinking about that this morning. So that is on my urgent critical items to review. So yes, definitely I'm looking into that. And I hope to have something that I can share with you all from other states that would help guide us as well. Thanks. All right, and then Michael. Go ahead.
I wanted to comment on that because I have colleagues across the entire country that have gone through these processes before, and as this group decides, we could bring in others to talk about that. Melinda, I could help you with making contacts there. We are not the first to go through it, although we're not the last either. But there's different models based on the states of what they do. But happy to be a resource for that.
Excellent, thank you. Chris, did you have any other further comment on that?
Oh yeah, I just wanted to point out that prior to last month, the best practice was probably the Chance Healthcare model, but that has just been hacked and shows how once you build all these intertwined systems, what one bad actor can do to the entire healthcare system. So just wanted to, I know we have somebody from healthcare security on here. Just wanted to really point that focus out as well.
Yeah, great point. Thank you. Any other comments from the group? All right, then we will go ahead and close out this agenda item and move on to agenda item number 8, discussion of the 2024 meeting dates. So I put in a proposal here for the first Thursday of every month between now and June from 10 a.m. to 12 p.m. So just wanted to poll the group and see if that worked for everybody, if there's a time that might work better, but please let me know if that works or not. Seeing a lot of head nods, so I think we're good. Perfect. All right, we will go ahead and send out those meeting invites shortly. So please let me know if you do not receive them. All right, moving to agenda item 9. Oh, I'm sorry. Celestina, please go ahead.
You are on
you're on mute. Of course,
Sorry.
right? That's okay.
I have some standing meetings on those Thursdays that start at 10. They don't go very long, so either I'm going to join late or I'll have to figure out something.
Let's see. Okay. I'm not sure if we could move it to start at 10:30. If that would mess anybody up, like, would that work better for you if we did it 10:30?
That would work better for me. But
Does
I don't
anybody have
want
any issues? I know, right? Yeah. Anybody have any issues if we start at 10:30? Oh, Sandy, go ahead, please.
I don't have any issues. I was just going to suggest that you do a poll of everyone. There's a lot of people on here and we could be here all day if we start talking about people's conflicts. So for efficiency's sake, we might be able to just do it via poll.
Yeah, for
Offline,
sure.
if that's allowed, Gabe.
Yeah, I think that's fine. Why doesn't everybody email to Melinda their availability for a certain time? Like if 10:30 works, that's great. Maybe even 10:15, depending on how long Celestina's meetings generally last. But I think that's a great idea. Have everybody send their availability to Melinda.
Excellent. Okay. So agenda item 9 is public comment. Again, no action may be taken upon a matter raised under public comment period unless the matter itself has been specifically included on the agenda as an action item. Comments will be limited to 3 minutes per person. Persons making comments will be asked to begin by stating their name for the record, and I'd like to go ahead with public comment. So please feel free to raise your hand, use the raise hand feature. If you are on Teams or if you're calling in, you may press *5 to raise your hand. Okay, seeing no public comment, we will close out that agenda item and move on to agenda item number 10 for adjournment. So we'll go ahead and adjourn the meeting. Thank you all again for your time today, and I look forward to working with you. Have a great day.
Thank you, everyone.
Thank you, Melinda.
Yeah, thank
Thanks,
you.
everyone.
Thanks, everyone. Bye-bye.
Thank you.
Thank you.